Hello everyone. I'm very glad to introduce our speaker, Dr. Katherine Panageas. Dr. Panageas is Associate Attending Biostatistician and Director of Research Support at the Memorial Sloan Kettering Cancer Center. And MSK, she is involved in analysis of cluster correlated data methods and random effect model in health services research. And now she is also involved in developing frameworks for hospital profiling in cancer care for health policy and outcomes. Today she will give a talk about what it is like to work as a biostatistician at the MSK and the professional development of programs offered at the center, and review the interview process and also detail the career ladder of biostatistician. Let's welcome Dr. Panageas.
Thank you so much. I'm so happy to be here. So I'm going to go through a little bit about MSK and the program that we have in the Department of Epidemiology and Biostatistics. I'm assuming everybody here is a master's candidate in biostatistics for the most part, or some quantitative discipline. So Memorial Sloan Kettering is a cancer hospital. It's uptown, midtown, and we're on 68th and 1st. We have a Department of Epidemiology and Biostatistics within the hospital. The department is one of 11 departments in the institution, and the department has 4 main divisions, which would be, they're not called divisions, but they would be if they were at a university. So they're called services because we follow a hospital format, and the 4 services that are under the department are Biostatistics Service, Epidemiology Service. The Health Outcomes Research Group is technically not a service, but for our purposes here, we can assume it's a service. And then there's the Computational Oncology Service. So those 4 groups fall under the Department of Epidemiology and Biostatistics. Within the, I'm going to say biostatistics for last, because I think that's probably what most everybody here is most interested in. The Health Outcomes Research Group comprises of about 6 or 7 faculty members, and then different levels of support staff. We have data assistants, we have data analysts, and we have 4 research biostatisticians within that group. So it's a pretty small service, relatively speaking. Epidemiology is also about the same size, and then computational oncology is growing at very, very fast pace within the institution. There's probably 7 faculty members right now, and it'll probably grow to about 10 to 12 in the next 2 years, along with many people that are computational biologists, bioinformaticists at the master's level, data engineers. So a lot of people kind of cross into that group that might have a graduate degree in biostatistics with a computational oncology or computational biology interest. And then there's epidemiology, which is also relatively small, about 6 or 7 faculty members and growing. And because the investigators in EPI tend to be their own PIs, we have program coordinators and the people that interview, so underneath the faculty members within EPI. So traditional studies of EPI are conducted within the EPI service. Health Outcomes is more interested. The focus is on health policy, health services research. Peter Bach is the head of that group, and he has a drug pricing lab. So his interests are all in the cost of drugs and oncology drugs, and he testifies in Congress a lot. So his focus is more of a health economics angle, but we hire people that are at the master's level that work within health economics and drug pricing and cost of health services. It doesn't have to be cost either. It could be health services type outcomes and patient level outcomes. And that's sort of the work that goes on in health outcomes. EPI is more traditional EPI work. Computational oncology is bioinformatics and comp-onc. And then in biostatistics, in the biostatistics service, which is the largest service in the department, we have the 17 faculty members with a primary appointment in biostatistics and about 20 master's level biostatisticians. So we are a critical mass of about 40 people with a biostatistics service that have primary training in biostatistics or a related field. Some people are interested in compound or data science, kind of a little bit more of an angle. So within the department, I'm appointed in biostatistics service. I work with melanoma and immunology and clinical trials and immunotherapy. I know this isn't really a cancer-focused group, but that's sort of one of my areas. And I also work with neuro-oncology, so brain tumors. So in terms of my clinical areas, those are the two areas that I work in most closely and have for probably the past 15 years. I also have an interest in health policy and health services, so I work with Peter in that group, not from a cost side, but more from health services research. So we do a little bit of clinical trials, a little bit of neuro, and a little bit of health services. So it kind of a little bit more broad relative to other faculty members in the department. And then I also manage the group of master's level statisticians. So we have 20. And I'm here to kind of today talk about our group and our program. And there may be some people in the room who have actually applied for some open positions that we have. And I'm happy to talk to anybody if you have applied. And anyway, I'll be here for a little while after. So we are growing this group. We're about 20 right now. We should be going to 22 or 23 in the next year. So what we call the terminology, research biostatisticians is the name of the position. What I will explain after is multiple levels of the position, but basically research biostatisticians work with the faculty. When you come at an entry-level position, which is right out of your master's, you will work with probably 1 to 2 different biostat faculty members as your core work. So you could work with 2 people about 20 to 25% of the time each, and that's about 50% of your time is allocated. So you may be allocated in prostate cancer with Glenn Heller, and then another about 25% of the time with me in neuro. That's kind of your core focus of the work that you do. You become part of that disease management team. You will work to learn the research program. You'll learn that particular disease, usually with 2 diseases and 2 biostat faculty members. And then for the other 50% of your time, you'll work with any one of the other 17 faculty members in the department. And the reason why I do that, a lot of places have a 1-to-1 where you'll work and get, if you go into a biostat department, you may work with one particular faculty member. That's great when it's great and it works, and it's not great when it doesn't. And I don't think that when you're new and coming out of a graduate program, you learn the most in that model. So we like to have you work with 17 different people, and you may like the way I collaborate, and you may not like the way somebody else collaborates, or you may like my reports, or you may like investigators. So part of that, at least for the first 2 to 3 years that you're in the position, we like to have you rotate through on different projects and work with different people, because people have different skills, different styles, different. It's not just from, there's a statistical methodology that you'll be learning from different people as well, but it's also more stylistic that I'd like for you to kind of grow and kind of mold yourself as a collaborative statistician by being exposed to everybody in the department. So that's a little bit of our model. You'll have some core work, but then you'll also work with a lot of different other people within the department. So a lot of the work, the analytic work, is conducted by people at this level. So if you're not interested in data, real data, like really getting data from fellows and clinicians and accessing data, and what I mean by that is really understanding the data and understanding the research question and really having a context that this ultimately, impacts patients, then we're not the environment for you. So if you want to be working more with abstract data or not so close to that connection with the patient component, not that you don't interact with patients, but that has to be important motivation for you to be working in our environment. Otherwise, there's plenty of other places where you can have access to data but not necessarily be so close to the meaning of the data and be more running algorithms or, generating reports, but not so. So that's kind of really important for us. So I kind of said that we have 20, we're growing. When we have a search that's open for the MasterLevel Positions, the search is conducted in a very similar way as faculty level searches. Not in the sense of academic appointments within the institution, but we have a nationwide search for these positions. So there's a lot of competition. I have a search open right now, and I probably have 300 open active applicants. You will apply for the position. If it looks like you have the relevant degree and training and interest based on your cover letter and resume that's submitted, we'll ask for 3 letters of reference. So for your package to be complete, we need 3 reference letters along with your cover letter and resume. So at least 2 of those should be from your graduate school program or from some biostatistics or quantitative science related field. And 1 could be from a previous job, or it could be a character reference, but at least 2 need to be commenting on your quantitative skills. Once we have your package complete with 3 reference letters in your resume, there's a search committee that meets. You review, and you're invited for an interview. Or what happens actually next is you will go through a phone interview with me if you're selected. So that's the next drop down in the tier. If you're selected for a phone interview, I will have about a half an hour phone interview with you to see what you're actually interested in and see if the match works. And then there's a search committee meeting, and then you would be invited potentially for an interview. The interview's all day. You come probably from like 9 to 5, so it's very similar to our faculty interviews. You meet with about 8 or 9 different faculty members in biostatistics. If you were interested in health policy or computational oncology, you may meet with one of those 9 slots, maybe with somebody from health services or from computational oncology or epi, but for the most part, you meet with biostatistics faculty, half-hour increments, and you have to give a seminar for 1 hour. So that's pretty similar to faculty. We've actually extended our faculty interviews, and they're a day and a half now. Obviously, the expectation of the seminar is not the same as what we expect for a faculty interview, but we are looking to see how you present, to see if there's a project that you worked on that you have followed the research question, the data analysis, and does not have to be, we're not looking for super complex data analyses. We're not looking for simulations. The programs across the country are very varied. And some have a requirement for a dissertation, some have a practicum, some have 40 credits, some have 30 credits, some have 48 credits. So there's a lot of heterogeneity in the master's programs across the country, and we know that. So sometimes people present on a really in-depth homework assignment in some topic that might be of interest, but how well do you understand it? How well do you understand the data? Do you understand the research question? Do you understand the analyses that you conducted? And can you interpret it? And what did you learn from it? How would you present this to a clinician? How are you presenting your tables, your results? And what maybe would you have done differently, or what did you learn analytically and also conceptually from the project? Some people may report on 2 projects. If that works out, it's about 25 minutes for each. So we're really looking to see how you would collaborate. I'm telling you this so that, you know, if you are planning to interview or apply, you do need to kind of start kind of thinking about how you would maybe, what kind of project you would maybe present on. So I will say that we have people that come and interview and come and give a talk and try to impress with very fancy graphics or, you know, analyses that may be from drop-down or running packages. And there's usually at least 30 statisticians in the room that are very used to looking at data. And if you can't explain the figures that are in your presentation, it's not a good idea. If you just ran a package and you don't understand what is going on in the package, you probably shouldn't be presenting it. If you're presenting just output, that's not what you would do and give to a clinician. So I'm here to also kind of just, you know, give you guys some feedback for your careers and going forward that we've had many people come and first thing our chairman will say, well, what exactly are you presenting on the y-axis? And people can't answer that question. So I highly recommend that you don't just put pretty figures because you can generate them and, you know, spend time on your color palette to really understand what is being presented and what the study is or what the project is that you worked on. So it's not necessarily in-depth from a statistical perspective that we're looking for, that you need to, you know, be running lasso regression or something. So we'll teach you all of that. And that's part of why you're going to be rotating through early on in your career with multiple different faculty members. It's more, do you understand the data and the research question, and can you interpret it? So, we also recently started a data analyst position, which is a bachelor's level analyst position. We have 2 people in that position, and we're probably going to grow that further. That's not really relevant to this group, but in case I'm just sharing it. So just some, you know, we don't look for people with particular expertise. You know, if you have particular expertise and you're interested in clinical trials, or you're interested in machine learning, or you're interested in bioinformatics, that's fine, and we can place you in an area that might match what you're interested in. But we have people that are interested in, people's interests change too, especially since you're just exposed to certain ideas in you know, a 1.5 to 2 year program. So we don't really advertise for, we're looking for somebody who's interested in, you know, machine learning, and we bring somebody in. If you're interested in, we're just looking for good people that are interested to work for us, and we can match your interests with what our needs are, because we have so many needs. We have people that are working in all different areas, Bayesian areas, serum Medicare data. We have some people that are in the research biostatistician group that prefer not to interact so much with clinicians, and they really want to do our package in development and pipeline development, and that's fine. You know, we need that too. But I do ask that if you're just coming out of your master's, that you before you make that decision, you do spend a year working through, and then I meet with everybody monthly or sometimes twice a month, and we kind of figure it out as you build your career, because I hate for you to close a door without you really being exposed to other things. So I'm very big on career development and kind of try some things, and yes, we'll focus you in that direction, but you really haven't tried a lot of other things yet. So before you make that decision, let's have you try some different things. So machine learning, genomics, we have people that work in more psychiatry and behavioral type of work with quality of life and patient-reported outcomes. I don't know if there's anybody familiar with that type of work. Bayesian and development packages. So I would meet with you monthly, or sometimes, you know, at least for the first 6 months, maybe twice a month. And then we have a lot of other different career development initiatives for this group within the department, which is within the Biostat service plus FE plus health outcomes. So we have about 25 or 27 master's level statisticians across the multiple services, and we have what we call Tuesdays at 12. And every other Tuesday at noon, we have a gathering, which comprises either a master's seminar, an R users group, an open study group, or a coding workshop. And it alternates every other week to one of the other. So the distribution list is essentially the same for those four, but sometimes other people are also added. And this started with just master's seminars. So somebody from the group will chair this, and we rotate chairs. So you do get exposure to having kind of that organizational leadership kind of role. We do about 6 to 8 seminars per year. You may invite some people from the outside, or you may, we rotate within the department, and you need to give a seminar on basically anything you think anybody else in the group would be interested in. I started this probably about 10 years ago because people were very intimidated to speak at our faculty level seminars, and the level of questioning was a little bit more intimidating, so I created a group just for the research biostatisticians, and it's been a little bit of a source of tension because some of our talks are really good and faculty want to come, and they like it as this group so that the level is just amongst peers, and sometimes we invite other people, but it's really a nice environment to talk about, to give a seminar on anything, with the focus in learning. So if there's something that you've worked on, that you've figured out, that you think others would want to learn, then this is the place for you to do it, and you can sign up for 1 to 6 slots. And then we have our users group, which is actually a little bit broader. So people will this is kind of open to a lot of people in the institution and not just the department, but the research biostatisticians chair this as well. And this is a little bit more where if there's a new package, if there's anything related to R that somebody wants, much deeper level, anybody wants to discuss. Sometimes we have outside speakers, and packages are presented. We've actually developed our own packages within the department, and kind of sometimes we modify and present updates to that package that are relevant to the work that we do. And then 2 of the others are open study group and coding workshop. Apologize for that spelling error. And the research biostatisticians also chair these. Open study group is something we started just this past year, where it's one of the time slots where the group also gets together and can talk about anything. So it could be a journal club, it could be a presentation, it could be, I have this really difficult investigator and this fellow, and I don't know what to do. And so it's just this place to kind of talk about what you might want to talk about. I mean, some of it has been book group, and people who've done like chapters from Hadley Wickham's book. So anything, you just send to the chair what you want to go on to the next agenda. Sometimes we do just quick presentations, elevator pitches if people are presenting at conferences and we want to get feedback. So it's just another opportunity for everybody to get together in a much less formalized gathering. And actually this has turned out to be probably everybody's favorite because it's the least pressure, but everybody's together. And then we have coding workshop. So coding workshop is an opportunity where you can submit your code, SAS or R. I mean, some people to Stata, but we don't have that many Stata users. And you would submit it probably a week in advance. We put it on the shared drive, and we have an assigned reviewer or 2. And your code for a particular project would be reviewed. And this is in no way reviewed in any way for managerial review, for me to be reviewing and evaluating in terms of anything that would go into your performance review in any way. This is a complete learning tool. So if anybody wants to review code, it is for the reviewer to learn, and it is for the reviewee to learn. And it's made some people uncomfortable because, people don't really always want to submit their code, but there's a little bit of a movement to submitting code for journals, depending on the particular journal. And that's not really where we're coming from. We want this to be really a learning environment. So if you're a better coder than I am, I may have some suggestions for you as to why did you do it this way. Or sometimes we pick particular code to be reviewed because we think that there's something that a lot of other people can learn from. It gets a little tricky because a lot of times you want the data to be attached, and we can't always attach the data because of privacy rules and regulations and sharing it. So we kind of are working really just with the code at this point, but it's a smaller group that regularly attends, but we still have about 15 people that go to this all the time.
Yeah, question.
Yeah.
So for the biostatistician, so usually what kind of software, language they are using? SAS R?
Yeah. We are, we used to be a third, I would say, in the department, where we were a third SAS only, a third R only, and then a third both. This is probably a while ago, and now we are 75% R and 25% both.
That's great. So do you have
There's a few SAS only, but yeah, I think that's a dying. SAS, you can't, I don't know if you could be SAS only anymore.
Yes.
Yeah.
Real quick,
Yeah.
so I'm very infamous for asking lots and lots of questions.
Great.
So would you prefer me to just ask them all at the end, or
No,
just like?
no,
Oh boy.
This is no formal. This is,
Okay,
as you
you're
can see from the
in
slides, I'm just not really like any, yeah.
So for our seminars, that's part of the interviewing process. And then in these, like, for example, like the master seminar that you hold like on Tuesdays, are there also workshops to help us like improve, or are we expected to kind of improve on our own and just learn from peers in terms of just like seminar abilities?
So part of these four structured kind of settings is for learning and improvement. If you were to join our group, we have about a 16-session training program within the department, which is given by research biostatisticians. But we will go through, we have like, I should have actually brought the topics, but we'll go through intro to survival analysis, we'll go through competing risks analysis, we'll go through we have 2 of those 16 slots are on clinical trials. We go through, collaboration, how do you collaborate? We go through, let's see, screening and diagnostic tests, because you may not have had that in school. We go through cancer terms. So what is resist response? What is time to response? What is progression-free survival versus disease-free survival versus overall survival? So we kind of, once you're done with those 16 weeks, we don't expect that you totally know everything, but you'll have a slide deck that you can always go back to and kind of say, okay, so resist response is this. But to be honest, there's about 40 of us, and it's like a complete open door policy. So, and your first year, we kind of expect that you're not going to know the cancer terms plus the statistics terms.
Of course.
Yeah.
I can
Yeah, keep going.
So how, a lot of us work, but we may not work as like a true biostatistician, or maybe just like a small part-time like data analyst position. So how does like presenting seminars, how does that apply to like a real world job of like a biostat? Is it like very common across the profession where we're always getting seminars, or is it more just specific to your?
No, you're not. This is, so let's say So there's the seminar, which is part of the interview process.
Yes.
So let's take that out
Okay.
for right now. And then there's the master's seminar, which you would probably present once every 2 to 2.5 years. Because it rotates, it's 6 times a year, there's 20 people.
Okay.
So it's not something that some people present more frequently and some people really are a little bit, we kind of have to nudge and sometimes I give a topic and say this would be a good topic to talk about. But it's not something that every 2 weeks you're presenting. We have 20 people and 6 slots per year.
Okay.
But you asked about the work experience versus?
Yeah, so that's going to lead into a completely different question. But again, I do want to kind of delve into the actual profession and what you do.
Okay.
Just because, again, all I've done really is just very simple cleaning and stuff just because I don't have the skills yet to be a true biostatistician.
Uh-huh.
So what, could you give a day-to-day of
Sure.
a biostatistician, just as an entry level, I guess?
Sure. Should we say that? Well, let's go through
Yes. No
more of
problem.
the positions and then I'll go through a little bit more of that. So just other opportunities for people. We have we run the randomization for the entire institution. So for any trial that or any study that requires randomization, our department also does that, and we have 3 people within the research biostatistician group that actually are in charge of randomization. We have people that are in charge of continual reassessment designs. I'm not sure if you have a clinical trial class here. In any case, that's an adaptive sort of design where a patient may be in clinic and they need to know what arm that they're, or what dose level that they're receiving, and that requires interaction with the statistician at that time. So we have people in the group. So there's opportunity for other broader institutional kind of representation. And we also have protocol review. We have what's called a design and analysis workshop. The entire department gets, the biostatistics service gets together every Wednesday at 3 o'clock. And if there is a protocol that has one of us listed on it, it has to go through statistical review. So this is an opportunity where we all get together and there's an assigned reviewer and we have an internal review of the design of the trial and the analytic plan, as well as other components of the trial, and that happens every Wednesday. And then we have our departmental seminar after that. We have 3 co-chairs for that, and one of the co-chairs is somebody from the RB group. So there's a lot of opportunity and representation in the department for growth and involvement. And the career ladder, so I just want to go through this, and this is pretty much my last slide, and then we can go to more of the day-to-day of the work. We have 4 levels. We used to have 3, and I was able to add another level for promotion within this. So it sort of followed a faculty where you had an assistant research biostatistician level, then a research biostatistician level, and then a senior research biostatistician, which was analogous to assistant, associate, and full professor. We really wanted to work for retention, and I was able to add a research biostatistician level 2 in here. So the assistant research biostatistician level is for people that are completing their masters and really have limited experience. You may have worked during your master's, you may have had a graduate research assistantship, so you have some exposure, but you really haven't worked full-time in the field. So people that are basically entry level with their you need a master's degree in a quantitative discipline to get into this position. If you don't have a master's, you would be eligible for the data analyst position, level 1 or level 2, depending on your experience. People typically stay in this position for about anywhere from 1.5 to 2.5 years. So really the whole point of this position is, can you transition out of school? Can you work? Can you run your SAS programs? Can you run R? Do you understand data? Did you learn the cancer terms? Can you collaborate? Have you completed projects? Usually by the end of the first year, you'll have some manuscripts published, or abstracts that have been submitted. Are you working well with those two main faculty members? Are you learning? Have you grown? Basically, have you transitioned from school to the workforce as a biostatistician? If you're not, we can tell sort of right away within 6 to 12 months that it's not a good fit, and you probably are feeling that at the same time, and usually people don't stay. If you are successful in that transition, you move to research biostatistician. It's the easiest promotion. It's really, you kind of, when you look back on it after a year and a half or 2 years, you realize how much you did learn and how much you've applied from school to the work environment. And then there's research biostatistician level 1, where you're going deeper. You may become more of that team in that disease site, or just becoming more focused in your interests. And like I said, it could be anything. It could be package development, pipeline development. It could be more, data visualization, or it could be frontline and working with clinicians. So more in-depth, more growth, more diversity in your methodologic profile and what you're capable of doing, and starting to kind of develop a path that might be of more interest to you. As you start to develop that path, and there's no one and there's no right. So you could become more collaborative, you could become more data, you could be more big data, you could be, I don't really want to see clinicians and I want to be, in-house with the biostat people. So the spectrum, is very wide, and it's a little more flexible in that regard than faculty, where you have to do, pretty much is more overlap in what our responsibilities are. And then research biostatistician, this is 2, that should be a 2. There's a second level, and you again are becoming more involved and more deeper into your whatever that path is. The senior research biostatistician level is actually the hardest promotion. We only have about 3 people at that level, partly because you need to be there for a while. We have good retention, but the senior research biostatistician almost acts like a junior faculty member. So you may have a whole entire clinical service on your own. You may be running, you may be on institutional committees. You really understand how the institution works, or you've been involved. You may be, like I said, you may have a small clinical service that you work independently on, or you may be leading efforts within some pipeline development if you're more computational. So that's a little bit of the career track. Some people have a lot of experience and then have gone for their master's and may come in at a research biostatistician 1. But most people coming out of a master's come in at assistant research biostatistician position. So that's a little bit about our department and kind of the types of positions and the interview process. In terms of the day-to-day, so everybody, I would say, works with data. It depends on your strengths and weaknesses and where you are in your growth. So some people may have more smaller projects and more data cleaning. Within that, some people may have more big data and working with big data. They might be more with maybe working in a biostat research project long term. So you may be running simulations if that's a little bit more of your particular interest. But most people will have a profile of 5 smaller projects that they'll be moving through, and that usually comes from their 2 main disease sites, and regular interaction with the clinicians on those particular projects. And then probably 2 longer term projects. that could be a little bit more methodological or a little bit more applied but longer term.
But that would also be based upon like your strengths and the faculty you're working with, that's all, right?
Strengths and weaknesses.
And weaknesses.
Yeah, yeah. So, I mean, I don't, until you get to like really a higher level where your strengths are kind of where you want to go, if you just early on focus on your strengths, you're never going to go back to your weaknesses. So we want to, but it depends on what's going on at a given time, right? So if you've never done something, a competing risks analysis, let's say, and there's a quick deadline or an abstract or the data are very complicated, and you've never done a competing risks analysis, I'm not going to give that to you. So when you're in a more learning environment, there needs to be an opportunity for that to be at a slower pace. So it's not like, because then you're not going to do it well or right, or you're not going to learn from that. So, but that's where communication has to come in. So as a manager, you have to, we have to be constantly communicating.
Very briefly, so if you were to graduate, have a master's, and then you work a couple years outside of like MSK, then what is the process, the interview for like, different, like one of the research biostatistician levels?
The interview process is the same.
It's still the same?
Yeah. Yeah. The interview process is the same. We would, obviously the evaluation of that candidate is a little different, right? We would expect that you have a little bit more experience. We would expect that you have greater understanding of what you're presenting and what you're going to bring to the department as opposed to somebody fresh out of school. So we may evaluate you differently, but your interview process is the same. So you don't skip our interview day if you have experience. Yeah.
So, kind of similar to that question. So, is there like an equivalency level of like work experience or a PhD program that will allow us to kind of skip the assistant, maybe like the research one? Is there a way for us to kind of apply to higher positions early on?
Oh, I mean, if you have work experience, relevant work experience, you would come potentially, it would depend on what your experience is.
Okay.
But yes, you could come in. Now, if you had a PhD, you would not come into any of these. So we have recently, you wouldn't work in these. We wouldn't put you on this track. Even if you look, okay, I should clarify. We have had people that have PhDs in different disciplines, so that have been on this track. So you may have a master's in biostatistics and a PhD in biology, and we will hire you into this career ladder. If you have a PhD in statistics, biostatistics, quantitative sciences, data science, we will not put you here. So you will not be in this research biostatistician position. But we do have a non-faculty doctoral level position, which is called a principal biostatistician position. So if you've had a doctorate in a relevant field, you could come in on that. And it's not a faculty appointment within the institution, but it's a heavily collaborative position, and it's kind of new for us. So we're trying that out. We do have people, and part of my building of this group has been to allow people to go to school while they're in this position. Now, obviously, we're not going to bring somebody in an assistant research biostatistician position, and in September you're starting and you're gone, 30% of the time in a graduate school program. But if you are somebody that we do want to invest and you want to stay, we have tuition reimbursement, and we have a relationship with Columbia. And I hope at some point we have a relationship with the program that's being built here. And we kind of work together with whoever's in the group to, lead and take your classes. And, obviously it's tough, you're working full time, but we do have about 5 or 6 people that have done that. One woman is working at Cleveland Clinic. She's a faculty appointment, so she stayed with us for 10 years, and then 5 years in, started her DrPH at Columbia, finished. She just got an appointment at Cleveland Clinic, and it was great. And she got promoted to the tracks, and then we have somebody else who's at Mount Sinai, and a few people have left to go for their PhD, and we have 2 people enrolled in somebody else who's kind of done that path. So we've had 5 or 6 people in that. We were very open to it because if you want to continue learning and you want to grow and you have shown that you are, I mean, it's not easy on the candidate, right? You're going to have to work on the weekends and you're going to have to make up your hours and you're commuting uptown and midtown and we're downtown and uptown. But if you're willing to do it and improving yourself, we're willing to support you. Yeah. So I've had to make a push for that, but it's been worth it. And that is part of what has happened, why we developed that principal biostatistician position, because we do want people in this group who do go for their PhD, who may not want to, or we may not have a faculty position open at a given time, but we want to have an opportunity for you to roll into the next would be a PB, would be a promotion from this. But you need a doctorate for that. Is that helpful?
Absolutely.
Okay.
And again, I have more questions, but I kind of want to wait. You go ahead.
So, as the position for the assistant research masters, is it on a rolling basis? Like, we graduate in May, so is it like,
Okay, that's a great question. So we have a position that's currently, we have an opening right now because we're growing. We're trying to expand. We do not, you can apply today if you're interested. And you may not start until May or June, okay? That's totally fine. That happens all the time. Usually our better candidates apply in September and they don't join until May or June. People that are usually, February, March, April. So don't wait. Don't wait. We follow the calendar and we would want you to apply in September, October. I may not rush to bring you in for an interview. You may not come in September 25th for an interview, but in the fall, and then we extend your offer and you start. We just had somebody that she just finished at NC State and she was doing an internship at NASA and wanted to continue her internship, and she wanted to continue it for another 6 months, so we just didn't start her for 9 months after her graduation. So we're very flexible. We want to get the best people, and if it